Today we are focusing on chronic kidney disease, or CKD, a topic that frequently appears on the NCLEX. The exam wants you to understand that CKD is a progressive and irreversible decline in kidney function. It is not acute kidney injury, which can often be reversed. The key diagnostic marker you must know is the glomerular filtration rate, or GFR. The NCLEX will test your understanding of the 5 stages. Stage 1 involves a GFR over 90, but with some kidney damage like proteinuria. Stage 3, with a GFR between 30 and 59, is where you'll see many complications starting to become clinically significant. Stage 5, or end-stage renal disease, is a GFR below 15, which means the patient will require dialysis or a transplant. Exam questions will often give you a patient's GFR and ask you to identify the appropriate nursing intervention. For instance, a patient in stage 4 CKD with a GFR of 25 milliliters per minute will have significant fluid, electrolyte, and waste product imbalances. Your primary concerns are fluid volume excess, evidenced by crackles in the lungs and peripheral edema, and life-threatening electrolyte imbalances, particularly hyperkalemia. An NCLEX question might ask which finding for a patient with stage 4 CKD requires immediate intervention. The answer will almost always be related to cardiac rhythm changes from hyperkalemia, like peaked T waves on an EKG, or signs of severe fluid overload like respiratory distress. To help you remember the key lab value changes, use this mental shortcut. Think high, low, low, high. This stands for high potassium and high phosphate, which then leads to low calcium and finally low hemoglobin due to decreased erythropoietin production. The NCLEX loves to test the relationship between high phosphate and low calcium. The body pulls calcium from the bones to compensate, leading to renal osteodystrophy. Your nursing interventions would include administering phosphate binders with meals and teaching the patient to avoid high phosphate foods like dairy and dark sodas. Let's consider a common exam trap involving medications. A question might present a patient with a GFR of 20 who has an order for an NSAID like ibuprofen for pain. Your job as the nurse is to recognize that NSAIDs are nephrotoxic and should be questioned. The same goes for certain antibiotics or contrast dye used in imaging. The exam tests your ability to act as a patient safety advocate. Dietary management is another heavily tested area. For a patient with a potassium level of 6.1, the nurse must intervene if the meal tray includes a banana, potato, or orange juice. You need to know these high potassium foods. Finally, as the disease progresses to stage 5, questions will shift towards dialysis and transplant care. You might be asked about patient education for peritoneal dialysis or assessing the patency of an arteriovenous fistula for hemodialysis by feeling for the thrill and listening for the bruit. A lack of a thrill or bruit is a medical emergency that you must report immediately.